Vaccines, as you know, vaccines are very important. But we know that there are many factors that affect either vaccine response, uptake, and rollout. It's not only one, whether it's science, biological, but it includes social aspects, access, factors that could affect our immune responses. There are so many factors. And I think we have an opportunity to look at all these different areas to ensure that we address them so that we can have vaccines that will be effective in our communities, will also be accessible by our communities. So we are coming together, different institutions, led by Uganda Virus Institute, the MRC, Kilifi, as you have heard, our colleagues in the UK.
And my role in this meeting was to present it to the Uganda Virus Research Institute as a research organization to research into the constraints which make us not to hit our targets. So I was feeding into their research agenda. There are health systems issues. There are issues to do with human resource. There are issues to do with the vaccine distribution. There are things to do with the health worker availability. There are also, more importantly, things to do with the community attitudes, community perspectives.
The problem that we've seen is that some vaccines work better in some communities than others. So, for example, an early observation was that BCG vaccine works better in temperate countries like the UK than it does in countries on the equator, like Uganda. So we started by thinking about the biological reasons why some vaccines work better in some communities than others. But then we realized that some of the biological reasons that might, like maybe other infections that people have, those are also related to social reasons, like what sort of environment people live in, so that the difference between living in a city and living in the country. So
the VHCs were more